Thanks for having me. My name is Faustin Mukena. I'm the Chief Executive Officer of Africa Resource Center. We are a non-profit organization from the continent. We are based on the continent and we work with the people from the continent. And the reason I'm insisting on this is that we support governments. We are working with government to advocate for women, to advocate for supply chain, to be as part of their strategy, part of their policies. And what we see as a challenge as we do this is that it's more about funding of that strategy. Execution of the strategy never get to maybe 30% will be like a great achievement. We do that on the continent across, for the moment, 14 countries. We have offices in Nairobi, in Dakar, and in Cape Town in South Africa. And we support countries from West Africa like Nigeria, Senegal, Mukena Faso, and a couple of others. So back to the point that Joanne was making is that as we work with governments, trying to ensure that medicines get delivered not only to the last mile, but as close as possible to the door of the patient, it's very important. What we see is that people are more worried about procurement and less about how does it get to the central store and how does it move from the central store in the main city to all the villages across the country. And that's is not what is thought through. And we are advocating to ensure that this can happen by working with private sector in the country and ensure that the partnership between private sector and public sector shouldn't be seen as a competition, but should be seen as a partnership, working together. And also supporting local innovation. There are a lot of local young people who are trying to develop things, diagnostic, on the continent, but they don't get support for lack of funding. So those are the advocacy that we try to do. We have an independent view vis-a-vis the government, because the government, as much as they are our clients, because of their priorities, we don't build the government. So we source our funding so that we can give our point of view independently to the government. So they kind of support that and agree on that. So we started about 7 years ago, very young, supported by the people who love that mission. We were supported at the beginning by USAID, the Gates Foundation, the Global Fund, and we're looking for more funding as well to continue as we continue to advocate on this. On women particularly, it's important to note, and I'm not gonna say something new here, that on the continent, women is the economic power of any household on the continent. And the health of women is as critical as development of the economy. So it's important for us as we advocate to this to see how do we put together some programs that can support women economically so that they can be free in terms of, or independent in terms of their health as well as they grow.